Thank you, Chair. And Zara, if I can come back to the point you were making earlier about language, could you expand a little bit about what you meant there? So above and beyond physically translating public health messages into different languages, you seem to indicate that actually what needed to be considered was the actual content of the language itself. Could you expand a little bit more about what you meant there?
Oh, can you hear me?
Yes, can hear you now.
Yeah, we're back. Okay, sorry. So yeah, I think what we were saying is that, whilst written content is important and written content in different languages, what we found to be particularly effective is the use of infographics. So more kind of breaking down that information into, I guess, visual learning and making it more bite-sizable, because even within languages, there are cultural differences and nuances. And our translators had a fun time, I guess you could say, with all the different kind of, I guess, regional dialects. And, there is a lot, there's only so much you can do. But I think adding that pictorial aspect to it really went a long way. We would break down our kind of guidance into 9 steps, so reopening your mosque, or health and safety, or how to do your risk assessment, or, reasons for taking the vaccination. So just chunking that information into 1, 2, 3, 4, 5 different stages, different parts. And that has been really effective. People just share those messages, they print them into posters, they hang them up, they share them on places of worship. So that's been really good. I think also, videos have been really important. And I think really short clips, sound bites are really important, as well as audio messages that have been verified and shared, so someone just gives an update, or what does this mean? Explaining the information, because we're assuming that just if you read it, they will understand. But actually, there's a little bit of step in helping people understand even the context of where this is coming from. It's trusted. And I think having some, a partnership in that process is really important. So it's not just a leaflet we give to someone, but it's a conversation we're having with them.
Thank you, Zara. And you were also talking about the important role that faith leaders have in communities to encourage vaccine uptakes. I wonder if you can give us some examples of how faith leaders have been working together to encourage vaccine uptake. So above and beyond them being important, what are some of the actual physical examples and steps that we can learn from that that you've seen that we can apply?
Yeah, absolutely. I think one of the things that we did, which was really important, was look at who does the community listen to, and that is, place of worship, their local imam, scholars, people of authority and trust. And so we got joint statements from them. We got them to share the messages to the community. Sometimes it was through phone calls. We had maybe over 40 to 50 webinars at this point. I've lost track throughout the pandemic, but particularly even on dispelling vaccine misinformation, understanding, what is the vaccine about. So I think we needed to include those faith leaders, not just at our level and the national umbrella, but locally, the local voices, bring them into the conversation, having joint statements that were circulated, again, getting them to do Facebook live streams, with their communities, online sermons, even for the place of worship that have been open, having that as part of the Friday sermon, where they share that message to the congregation. Again, encouraging young people where the elderly generation couldn't be, they weren't able to access it online. So giving them that information as well. So faith leaders have had a really important part in working with the different aspects of community, bottom up, top down, and looking to where we listen and where are the conversations happening. And obviously, with the limitations that we have, we can't actually physically go talk to people, but looking at, well, who do they listen to? And appreciating that we all have our limitations. We're not here to impose what people should do, but to listen to them and invite them into the conversation and understand where their concerns coming from. As has been mentioned, some were about faith and spiritual, procedural. Is this allowed? Is this permissible? Can I actually take this vaccine? Then others were like, oh, well, family members are saying I shouldn't because they're worried. What do you think? So there were lots of different conversations happening. And I think once we were able to just get through those points, then we were able to take them to the place of actually being open to changing their mind or to coming aboard. So I think it's a multi-pronged approach, but bringing in people of trust was really critical. And for us, we facilitated a national platform to bring in lots of different actors from healthcare, from burial and bereavement, from the charity sector, from mental health, to come together and work together, which was really important.
Thanks, Sarah. And Dr. Scholler, I wonder if I could bring you in on that question as well about actual examples that we might be able to draw from.
Okay, very similar to what Zara said, in the Christian community, again, what we identified right from the onset was that people would listen to and trust their pastors, their church leaders. And so we started with statements that were being made by, if I use my local church as an example, the pastor would talk about it during the sermon. I gave an example earlier where we invited some experts, some medical experts, into the sermon and gave opportunities for members of the congregation to ask questions, which were quite helpful. But then the other thing we identified at the same time was not just pastors working in isolation, but coming together as a unified voice. Again, I mentioned earlier, just last weekend, we got 60 senior faith leaders, Christian leaders, come together to endorse the vaccine and encourage congregations to take the vaccine. I've also mentioned about the workshops that were get. So a lot of these, like Zara said, webinars to bring information to people, just to bring reassurance. And it is actually ongoing. And what we've experienced, it's a combination of the big public meetings, but also the private conversations as well. Again, I gave examples of how I've had to call members of the congregation myself. They would trust me as one of their leaders to speak to them and answer their questions as compared to maybe somebody else. So a lot of that has been going on in the community, but I think the biggest win for us is the collective of the Christian community coming together, the senior leaders coming together to endorse the vaccine, to say, look, hi guys, we're behind this. And then lastly, in terms of what we found has been quite effective, because this came out from one of the very first conversations we had. One of the conversations that came up was, are you going to take the vaccine? So they want to see that their leaders are taking the vaccine as well. So you're not just telling them, you're actually leading by example. And that's what we've been doing quite a lot, making sure that we capture when each one of us has been taking the vaccine and then letting them know that it's safe to do so.
Thank you, Dr. Scholler, and I will let Ben pick up from there. No more questions from me.